I will, in the next 10 minutes, I will start out by briefly describing this practice field of eMental health, as Mette has just introduced. So what it is and why we are doing it here in Denmark. I will look into two specific examples of eMental health applications, so to speak, simple solutions, as you mentioned, Mette, solutions which have been crucial in order to handle the delivery of mental health in the hospital where I work during the COVID-19 emergency. And I will conclude with a few words about how we are moving forward in Denmark with this interesting area, eMental health. So in Denmark and globally, we share a set of mental health challenges. In Denmark alone, it's estimated that 1 in 5 Danish people per year are affected by mental health issues, and we see a troubling increase in mental health problem among young people. Increasingly, it's recognized that this treatment gap in mental health is widening, creating a need for transformative change in the mental health care system. COVID-19 has only reinforced these difficulties. So while eMental health may not completely solve this treatment gap, it has the potential for being able to address some of the barriers facing people with accessing mental health care. So eMental health, it's, well, the delivery of mental health treatment and support using digital technologies such as apps, online programs, video consultations, and so forth. So digital tools for mental health is about increasing access to mental health treatment, and it's about improving outcomes for people with mental health problems. So digital technology has the potential to transform mental health care by connecting patients, services, and health data in new ways. Benefits include greater flexibility and convenience to patients, so services tailored to specific needs and preferences of patients. It includes rapid access and shorter wait times. Digital services can fill service gaps and are potentially cost effective to the healthcare system. Especially, I would like to emphasize the bridge spanning capacity, which is a very important remedy to our often siloed health and social care system. So with digital tools being used for both physical and mental health conditions. So the cons against using digital tools include, of course, concerns about data security and privacy, so technical difficulties, low engagement, low retention rates among users, and most of all, a very uneven evidence base for effectiveness. So as an organization, Center for Telepsychiatry, we strive to address both benefits and drawbacks for using digital technologies. Well, Mette just briefly introduced so our center, so I will just go very quickly over this. One of our main tasks at Center for Telepsychiatry is to support and facilitate the use of video consultations in outpatient care. This graph shows the dramatic change in use of video consultations in the previous 9 months. So video consultations, they have proved vital in managing the COVID-19 crisis at our hospital. So in this hospital where we work, all outpatient care shifted to virtual visits, that is telephone and video consultation visits within days when the coronavirus hit us in March. And so at the height of the first wave, the hospital reverted to 70% online consultations using video and telephone consultations. In our hospital, we've used video consultation for the past 5 years prior to the coronavirus. So this experience enabled us to move fast when the coronavirus hit us in March. So the service model has been implemented at scale from 2015, with reimbursement for services equaling face-to-face consultations, which has been very, very important. The service model is that, well, the clinician is sitting at the hospital, the patient is in their home, and video visits are used as an adjunct to regular care. It's used for medication management, psychotherapy, and other forms of support. So when the COVID-19 hit us, we faced a serious gap between high need and capability of our available video solution. So in the first week of the pandemic, we shifted to a completely new video platform and carried out a very swift implementation of this new video system in each mental health department in our hospital. So a kamikaze implementation strategy. Key learning points from this very swift implementation has been the importance of technical support and the establishment of local infrastructures of key contact persons, enabling professional peer support, so creating this sense of technical safety. Also the point about tailoring support to both patients and staff. This has been very, very important to us. Now moving on to another example where eMental Health is used to increase access and to bridge gaps in service provision, internet delivered psychotherapy. In internet delivered cognitive behavior therapy, a long word, it's called ICBT for short, patients have access to online treatment materials that are based on CBT self-help manuals and designed to provide the same information that is provided in regular face-to-face CBT therapy. So the online format of the ICBT service enables patients to access lessons in a time and place that best suits their needs and may foster self-efficacy in patients who complete the programs. Additionally, ICBT reduces therapist burden. As an average, therapists spend between 15 to 20 minutes per week supporting each patient. So the Danish Internet Psychiatry Clinic is a national digital mental health service, and it's funded by the 5 Danish regions in collaboration. The service has been operating since 2015 in routine care and has since this time provided online psychological assessments, online therapy, and referral services to more than 4,500 patients. Research from the clinic demonstrates significant effect sizes comparable to regular face-to-face treatment, and the socio-demographic distribution of users closely matches that of the Danish population. So we see all kinds of patients accessing our service. During the COVID-19 emergency, we received permanent cross-regional funding for the service due to a very, very strong policy support for online therapy services. So, what are our prerequisites for moving forward with eMental health or digital mental health here at Center for Telepsychiatry? Well, the benefits of technology-enabled access to mental health care services are profound. But in the present crisis and beyond the crisis, hopefully there is a beyond, these benefits can only be realized if digital tools are trusted and used by patients and clinicians. So moving forward with digital mental health, we need, first of all, data-safe and user-friendly tools addressing unmet needs among patients and staff as well. We need training among healthcare professionals. And next, we need clinical guidance around implementation and delivery of digital mental health. This is very, very important. We have a strong evidence base for how digital mental health is used to offer effective care in several psychiatric conditions. For example, we know that smartphone apps can be very useful tools for some patients, but their effectiveness more than doubles when used with some form of human support. Well, in collaboration with a clinician. So codifying current evidence in clinical guidelines will ensure that the digital tools are optimally used in mental health care. Finally, patient partnerships in digital service design is crucial because patient partnerships will ensure that these new services are accessible and usable. We already know that there is a digital divide between in our patient population because of both a lack of technology and a lack of access to online resources. So today we can build IT platforms and tools, but building the right ones for patients will require much closer partnerships. So to sum up, we need to invest in training, in guidance and support for digital health equity to ensure that digital mental health will continue to improve care every day and also post the COVID-19 pandemic.